Hello, everyone. Welcome to another special webinar for the students. We have now, our topic for today is comparison of the pulse and tongue diagnosis. Okay. So earlier during the assessment, we have learned that the chi moves blood, no? And from the pulse, we can actually determine the quality of the chi and the dynamics of chi movement. So when we talk about the pulse, it actually describes the present energetic condition of the individual. So compared to tongue, it would be very easy to see a change in the pulse. And the more recent um, imbalance. So by feeling the pulse, the practitioner enters into close relationship with the patient, perceiving the quality of the patient's pulsating energy. So a very good example here would be like a 60-year-old woman who is always thinking of others first before her own, no? She complained about intense inner tension. So the tongue was normal, but when the pulse was felt, it was very wiry and thin. Okay? Tingnan nyo ha. The tongue is normal, but when the pulse was uh, was felt, it was very wiry and thin. So it was clear that she had developed liver qi constraint. Itong liver qi constraint, this is actually liver qi depression. So when the liver qi stops moving, it will definitely be called liver qi stagnation. And so hihina yung yin. So magkakaroon ka ng, the yin will not be able to control the yang. Okay? So magkakaroon ka ng liver yang rising. In the course of treatment, the woman was eventually able to begin fulfilling her own wishes rather than those of others. So that means this woman was treated for her liver qi constraint. Slowly, the pulse became less wiry, and this was accompanied by a greater sense of joy in her life. So, this is an example where the pulse is more important than the tongue because walang nakita sa tongue. It was the pulse that reflected the true energetic state of the patient. However, the pulse did not provide the indication of the length or the depth of liver qi stagnation. So it is only through the tongue where you can actually determine the the depth, no, or the degree of liver qi stagnation. So since the tongue picture was normal, it did not reflect any disharmony or might have suggested it was not that deep or serious. So the pulse diagnosis can be quite accurate when tongue signs are inconspicuous or unclear, no? Kasi normal but the patient came in with issues, no? In this case, the pulse was given priority over the tongue. So the tongue reflects condition of the blood, the yin, the body fluids, the essence more clearly than does the pulse. Okay? Pulse qualities like choppy, parang signal ng internet ni natin. This will indicate blood deficiency. Choppy. Kasi kulang, no? Depth and severity of deficiency is difficult to judge from the pulse alone and can only be made by an experienced practitioner. So we are not that experienced. A thin or dry contracted tongue makes the condition easy to detect. So especially if abnormal yung color, no? In such cases, we give priority sa tongue. Okay? So if you happen to have a tongue that's a bit thin or dry or contracted, so mas madali yung diagnosis. Occasionally, the pulse and tongue signs will not coincide with each other. So they deviate from each other. So if you have a tongue body that is pale and swollen, you have to expect a slow or submerged pulse. Okay? So yung mahirap na masyadong submerged yung pulse. So remember, pag pale ang tongue and swollen. Okay. A fast and floating pulse could be the result of, for example, if the patient was in a hurry for the appointment, or baka natakot sa iyo, no? Kasi sa need, or shock, no? Coffee and medication. So these are the things that you have to consider. Kaya when the patient comes to you, you have to make the patient feel more relaxed. Don't feel the pulse right away. Ako, I would allow like 5 minutes, 5 to 10. So the pulse can change very quickly in response to most recent event in a patient's life, while the tongue will remain unchanged. Okay? So the qualities of the pulse will accurately reflect the present, at the moment, yung energetic condition ng individual. And the qualities of the tongue, like the body, the color, and the shape, will allow one to predict long-term changes in energetic state. Okay, so to determine the chronicity or the acuteness of the illness, you have to look at the tongue coating. Okay? So obviously, pag masyado na makapal yung coating, so that indicates that medyo matagal na yung problem. So now let's go to your very favorite part of the presentation. We have a 25-year-old female. Okay? Uh, Symptoms niya are loose stools without smell. So when you present the symptoms, or when the patient will tell you na meron siyang loose stools, you should ask, ano ba, is it with smell or without smell? This is very, very significant. Kasi alam naman natin, if it's with smell, there is heat. Do you agree? So here, there's loose stools without smell 3 to 4 times daily. There's abdominal distension. So this is like very obvious. There's flatulence, there's mood swings. No Western diagnosis, and history ng patient, pertinent info, irregular eating habits. We all know that this can lead to an issue with the spleen, no? An excessive consumption of dairy foods, spleen as well, and unhappiness. So let's take a look at the diagnosis. So the tongue is pale and swollen. So this is definitely dampness, no? Kita nyo? Spleen chi deficiency is actually dampness. Okay? Pale and swollen. Based on the history, irregular eating habits, this will definitely cause spleen chi deficiency, and also excessive consumption of dairy products. The coating is light yellow and greasy. So we all know that there is heat if the color of the coating is yellow. Greasy means there's dampness, no? So the diagnosis, the Chinese diagnosis would be food stagnation, accumulation of dampness in the middle burner, which transforms into heat. So the issue is, okay, when you talk about loose stools, this is something to do with the lower burner, no? So parang lumabas na siya, so wala pa siya. So that means hindi pa siya ganun ka grabe. Okay? So there's still bago pa lang nag-transform into heat. Okay? So there. But I would like to give the diagnosis that this is damp heat, early stage pa lang. Okay? Because when you have with smell, no? Kasi if you look at the color of the tongue, hindi pa siya red. Do you agree? So any comments from the audience? Let's call on Miss Tang.
Yes po.
Doc She. Okay, do you want to make any comment, Mr. Jobel?
Ah, hindi pa masyadong mapula yung tongue niya, Doc.
Hindi talaga siya pula.
Ah,
Hindi talaga siya pula.
oo. Pero nawawala yung white coating niya, Doc. yung coating niya nawawala.
Actually, makapal na nga eh. Oh, makapal
Tsaka
na
may
siya.
may
Medyo
tracks.
distended yung lung area niya, Doc. Di wala bang medyo phlegm yung ano? Hindi ba inuubo yung pasyente
Distended.
niya?
Mm. Wala naman, wala naman. Kasi like ito yung symptoms niya. Abdominal distension, this is very, very spleen-chi. Flatulence, mood swings, no? What do you think is saan nagre-reflect yung unhappiness ng patient sa tongue?
Deeper yun.
Can having
Art,
yeah. Okay, ganito na lang. Most of I have patients who have mental issues, and I notice that their tongues are so huge and may phlegm. So I think in this case, kasi before siya mag-phlegm, mayroon munang dampness. Okay? This is where pag grabe na yung damp heat, of course, the heat will actually condense uh, the fluids, no? So magkakaroon ka ng phlegm. Hindi pa naman that big ang tongue, but I have seen bigger tongues. Sometimes super thick pa rin. And they have an issue na with their pag-iisip. Okay? So, I would like to emphasize that being unhappy, bakit kaya siya unhappy? Okay, female, 25 years old. Okay, so baka may mga ano talaga siya, like marami siyang, or probably, yeah, so being unhappy can give you,
Consumption of dairy foods and irregular habits.
yes, irregular eating habits. When you have when you say irregular eating habits, hindi pare-pareho yung time. No, like today you will have lunch at 1 p.m. Then the next day it would be at 10 a.m. or sometimes 5 p.m. So irregular eating habits, like, and then also too much dairy foods. No. So do you really think the diet has something to do with being unhappy?
Yes po.
Okay, can you give us? Can you justify your answer?
See, when you say excessive consumption of dairy food, so most likely inaraw-araw na niya. And overconsumption of dairy products would lead to dampness. So, syempre, mabigat yun sa katawan. And that alone would make you feel uneasy. Siguro since nag-accumulate na, kaya na siya the patient most likely would feel unhappy even on
Mm.
simple things.
Ayan.
Kasi nga, katawan pa niya, din na niya, ano.
Yes, and
Comforts
So,
doc.
also, pag may dampness ka, you cannot, your brain may not be able to receive the clear yang, di ba? Puro turbid. So pati pag-iisip mo malabo. So you tend to be unhappy.
yeah.
Do you like yon? And the worst thing that could happen here is when the tongue becomes red, no? Mm. And when there's heat, this is where this can transform into phlegm. And I'm sure you've heard about phlegm misting the mind, phlegm um, aggravating ano ba yun? The heart, something. So 25 years old, loose stools without smell. So this loose stools could be due to the fact that ito yon, irregular eating, excessive consumption. Okay. Okay, the flatulence have something to do with the any comments? So again, we have a pale swollen tongue, hindi pa siya red. Oo, kasi wala pa siyang ano, wala namang, like you were talking about a very thick front third. I don't think that's very significant kasi siguro papunta na rin doon kasi when you have spleen chi deficiency, it will also affect the lungs. And I think the reason why Doc She mentioned lung here, kasi we always associate unhappiness or sadness with the lung, di ba? Kaya siguro si Doc Shaes had patience na tinitingnan niya mabuti if like, makapal yung ano. Actually, if you take a look closely, it's actually the whole tongue that's swollen. Siguro, it would be very, very significant if you can actually see na yung front third lung, which represents the lungs and the heart, na swollen. Diba? So in this case, you can even determine na hiwalay, it's so difficult, right? And do you also notice the red spots here? So nag-i-start na po yung heat. Okay? Because you have your teeth marks, no? So this just goes to show that when you have accumulation of dampness, this is a very indicative of a spleen that no longer can do TNT, transformation and transportation. And the light yellow greasy coating, the longer the food stagnates in the middle burner, it will transform into heat. And siguro the next scenario here would be medyo magkakaroon na siya ng phlegm. Okay? So in the meantime, wala pa tayong nakitang sa phlegm. It's still dampness. Any thoughts?
Usually pag ganyan siguro, Dok, baka late din siya natutulog. Like, yung sleep niya rin siguro late na rin. Usually yan din talaga nakikita ko sa mga may spleen G deficiency din, Dok, eh.
Kung late natutulog siguro, doon tayo nakafocus sa liver, no? If titingnan mo mabuti yung liver, mukhang wala ako nakitang. Oo. Kasi 'di ba pag late ka natutulog, parati kang
Irritable.
yeah, oo. Kasi it will start as liver blood deficiency, hilo-hilo, and then you become cranky, irritable.
Kaya yung mood swings kasi din, Dok, eh. So,
Oo. Yung
Ay,
irritable, irregular eating habits yung siguro, kaya we concluded spleen chi. Kasi, yun nga, irregular. Di din regular si spleen nagwo-work. And they have their own body clock. So, most likely, si spleen talaga ang nasisira talaga. Kaya, that's why we concluded na spleen chi deficiency
oo.
talaga siya.
Yeah, so siguro eventually, like, it doesn't mean na pag may mood swings na affected na si liver. Siguro papunta na rin doon, di ba? Like, definitely, if you have a very weak spleen, um, walang makukuhang blood si liver. Do you agree? Oo, kasi
Yeah.
walang makukuhang blood, right? So, you will have liver blood deficiency. Yun. So, syempre, pag blood deficiency can lead to siguro una-una magkakaroon muna ng liver chi stagnation. Usually, pag liver chi stagnation, you don't see anything on the tongue. No? Hindi nilagay yung pulse kasi yung pinag-uusapan natin dito, tongue. So, okay, so thank you so much. I remember I asked Mom Athena to send some pictures. Thank you so much, everyone. So, i-ano na natin to, ang recording.